Eyewitness News is your vaccine authority. Right now, there is a growing concern, some big concern over an apparent heart problem in young people that's called myocarditis. A heart inflammation is being reported in some people, many children, after getting a vaccine. Joining us live this afternoon is Dr. Juan Salazar, Physician-in-Chief, Connecticut Children's Infectious Disease and Immunology. Doctor, thank you so much for joining us again this afternoon.
Thank you for having me, Mark.
Certainly alarming, I think, to a lot of parents especially. Explain what this is exactly. What's happening here?
Yeah, I want to emphasize that there's an association. We really have not established a cause and effect that the vaccine causes this. We have an association. And that association is that in very few kids throughout the country, after the second dose of the vaccine, within 72 hours, some of those young people have developed an inflammation of the heart muscle. It's called myocarditis, and sometimes an inflammation of the lining of the muscle, which is the pericardium. That's called pericarditis. When that happens, kids will present with some chest discomfort, chest pain, perhaps some shortness of breath, difficulty doing their normal strenuous activities. And when that happens, you should consult your pediatrician or come in for us to see you here at Connecticut Children's if any symptoms like that develop after a vaccine.
How soon after that second shot, doctor, would perhaps a child or a parent recognize these symptoms?
If it happens, and it's extremely rare, we have vaccinated a lot of kids. Been very proud that 12 to 15-year-olds in Connecticut, I believe a quarter of them have already been vaccinated, and over 50% of those that are 16 to 18. So they've actually answered the call. So thank you to them. Thank you to the parents for bringing them in. If it happens, and again, it's a rare event, it would be within 48 to 72 hours after the second dose.
All right. Well,
it is not the same. These are not the findings that occur immediately after the vaccine. Those are very common with a little bit of chills and fever and malaise and fatigue. Those are vaccine related specifically. The other ones would occur 48 to 72 hours later.
All right. That's certainly good to know. Now, why is this happening apparently to more boys than girls who are getting the shot?
Yeah, we don't know that, Mark. It's the association. It is correct. The case definition is something that occurs after the second dose within 48 to 72 hours. The cases that have been studied by the Centers for Disease Control and here in Connecticut and here at Connecticut Children's, the predominance tends to be in boys, males, 16 to 18 years of age. But we don't know. We don't know why that occurs. We're looking at it. We're going to study it, and we'll get to the bottom line.
Are there any potential long-term problems? I'm thinking, as I ask that question, you probably don't know at this point because this is all so new.
Yeah, we don't know that. And the kids that have come into Connecticut Children's, and there's only 3 of them, they have all gone home and they're doing pretty well. It is a mild form of myocarditis. My inclination would be to tell you that this is something that over the course of a few weeks will probably resolve entirely, and that there will be no long-term complications. But we will follow the children. We will see this. And like anything with COVID-related, it is constantly changing. And we learn about this. We find out. We use science, common sense. But again, message to you, parents, don't panic over this. It is important to get your kids vaccinated. We're almost there. We're getting to herd immunity. And the contribution that your children are providing to this is going to be exceptional. They'll have a better summer by being vaccinated.
All right, well, 3 children there, but they're doing well, so that's good to hear, doctor, certainly. And as you just said, you encourage folks to get the shot, and it's interesting, you see a lot of these kids, we see them on the air recently, they are very excited to be getting the shot. I think they want to go back to school and live life again. We all do.
Absolutely, and it is so encouraging to see them. We've vaccinated a number of those kids here at Connecticut Children's, and see their smile on their face that they came back to normal life, get together with their friends, with their grandparents, and enjoy, hopefully, the summer playing sports will be something that we look forward to.
Oh, my gosh, that's for sure. Dr. Juan Salazar from Connecticut Children's, thank you, as always, so much for joining us this afternoon. Good to see you.
Thank you, Mark. Good to see you, too.